7 health risks of sleeping too much. Number 1. Sleeping too much can raise depression risk. In a 2014 study of adult twins, researchers found that long sleep duration increased a person's risk of depression symptoms. The study participants who slept between 7 and 9 hours a night had a 27% heritability of depressive symptoms, while those who slept 9 hours or more had a 49% heritability. Number 2. It could impair the brain. A 2012 study found that among elderly women, sleeping too much or too little worsened brain function over a 6-year period. Women who slept more than 9 hours each night or fewer than 5 displayed changes in their brains on par with aging 2 years. Number 3. It might make it harder to get pregnant. In 2013, a Korea research team analyzed the sleep habits of more than 650 women undergoing in vitro fertilization. They found that pregnancy rates were highest among the women who got 7 to 8 hours of sleep a night and lowest in women who got 9 to 11 hours. The findings, however, did not establish a clear causal relationship. We know that sleep habits can certainly alter circadian rhythms, hormone secretions, and menstrual cycles, said Dr. Evan Rosenbluth, a reproductive endocrinologist. But the effect on infertility is a little harder to tease out, because there are so many details that are hard to control for. Number 4. Sleeping too much can increase diabetes risk. In a small study from Quebec, researchers found that people who slept more than 8 hours a night were twice as likely to develop type 2 diabetes or impaired glucose tolerance over a 6-year period than people who slept between 7 and 8 hours a night, even after controlling for differences in body mass. Number 5. It can lead to weight gain. The same researchers also looked at body weight and fat gain among Quebec adults over a 6-year period. They found that short and long sleepers gained more weight over the 6 years than people who slept 7 to 8 hours a night. People who slept 9 to 10 hours each night were 25% more likely to have gained 5 kilograms over the study period, even after controlling for food intake and physical activity. Hence, these results emphasize the need to add sleep duration to the panel of determinants that contribute to weight gain and obesity, the authors wrote in the study. Number 6. It can hurt the heart. In research presented at a 2012 American College of Cardiology meeting, sleeping 8 or more hours each night was linked to an increased risk of heart problems. The researchers analyzed data from over 3,000 people and found that long sleepers had 2 times the risk of angina and 1.1 times the risk of coronary artery disease. Number 7. Sleeping too much may lead to an earlier death. In a 2010 review of 16 different studies, researchers found an increased risk of dying of any cause among both short and long sleepers. Sleeping more than 8 hours a night was associated with a 1.3 times greater risk of death among the 1,382,999 various study participants.